Hello and welcome to Headline News in Prostate Cancer from the recently concluded ASCO 2012 meeting in Chicago, Illinois. I'm Steve Highsmith. We have selected various research findings presented at ASCO this year, and we will review highlighted information from those selected abstracts. For a more detailed review of each of the abstracts, we encourage you to please click on the links below this video. In an international collaborative Phase 3 clinical trial in patients with hormone-sensitive metastatic prostate cancer, intermittent androgen deprivation therapy, or IAD, was not shown to be non-inferior to continuous AD or CAD. According to Dr. Maha Hussein at the University of Michigan Comprehensive Cancer Center, CAD continues to be the standard of care for this population. The trial was designed to assess whether overall survival with IAD was non-inferior to CAD. The design of the trial specified that survival with IAD would be non-inferior to CAD if the 95% confidence interval for the hazard ratio excluded 1.2. In a secondary analysis, IAD was non-inferior to CAD in patients with extensive disease, but was inferior to CAD in patients with minimal disease. An updated analysis of the Alsimca study showed that radium-223 compared with placebo significantly prolonged median overall survival by 3.6 months in patients with castration-resistant prostate cancer, or CRCP. Follow-up shows a highly favorable safety profile. The findings from this Phase 3 multinational study suggest that radium-223 may provide a new standard of care for CRPC patients with bone metastases. In patients with asymptomatic or mildly symptomatic chemotherapy-naive metastatic castration-resistant prostate cancer, abiraterone acetate plus prednisone produced a statistically significant benefit in radiographic progression-free survival over placebo plus prednisone, according to a planned interim analysis of a Phase 3 study. According to Dr. Charles Ryan of the Helen Diller Family Comprehensive Cancer Center, abiraterone acetate plus prednisone delayed disease progression, increased survival, and extended time with minimal or no symptoms. In addition, no important new safety signals were seen in the randomized multicenter COUAA 302 study. The once-daily androgen receptor signaling inhibitor MDV-3100 was well tolerated and significantly prolonged overall survival in the Phase 3 AFFIRM trial, a randomized study that included 1,199 men with castration-resistant prostate cancer. Dr. Johan de Bono of the Institute of Cancer Research and the Royal Marsden NHS Foundation Trust said that the survival data are the best we've seen in the post-chemotherapy setting. Overall survival rates were about 5 months longer among treated patients, with a 37% reduction in risk of death. Experts who commented on the overall survival results reported in February said they expected MDV-3100 to win eventual approval from the FDA. That's going to wrap things up on this edition of Oncology.TV Headline News in Prostate Cancer at the ASCO 2012 meeting. Remember, if it's happening in oncology, it's happening on Oncology.TV.